To begin, we have all of our materials needed as well as suction set up because the patient is at risk for aspiration. Next, remember to draw the curtain for privacy reasons.
Good morning, Mr. Thomas. My name is Tanya, and I'm a student nurse at Prairie View. Your doctor has ordered you to have a nasogastric tube, so today I will be inserting that for you so that we can administer some medications.
Prior to insertion of the tube, Tanya is going to wash her hands because even though NG tube insertion is not a sterile procedure, you still want to maintain standard precautions.
Hello, Mr. Thomas. Okay, so now I have gathered all my supplies. We're going to go ahead and start with the insertion. Okay, first before I start my procedure, I will check the patient and have him verify his name and date of birth. In the procedure, we will put on clean gloves as this procedure does not require sterile gloves. Now we're going to measure the patient. So for measurement, you start at the tip of the nose and measure to the top of the patient's ear. Place a mark. After you measure from the top of the ear, you measure to the xiphoid process. Mark that area as well. Now that we're ready to insert the nasogastric tube, we'll have our patient sit in high Fowler's position. We also have our water-soluble lubricant. I will also have the patient blow his nose prior to insertion, and we'll also check for nasal patency to determine which nair we will be inserting the nasogastric tube into. For today, we'll be using the left nair. Our water-soluble lubricant, we place some on our nasogastric tube. This will help us while inserting the tube. So when we first start inserting the tube, we'll have our patient hyperextend his neck. Once we've reached our first mark, we'll have our patient flex his neck, and we'll also have him take small sips of water as we're further inserting the tube. Okay. We're going to insert the nasogastric tube until we reach our marking, our last marking. Okay, so once we've inserted our nasogastric tube, when we've reached the last mark, we'll gently secure the tube, basically so that we can check that it's inserted in the correct area. Okay. Initially, checking for placement, for correct placement, I'll aspirate stomach content. You should have green fluid. I'll reserve some so that I can also test the acidity of the stomach content. Remembering to return the unused portion. To confirm placement, we will complete an x-ray, and that will be our definitive results. So now we have an order for Ducosset sodium, 10 mLs, to be administered via nasogastric tube. So first, I'll pour up the medication, draw up the medication. We have our 10 mLs. Prior to administering the medication, you always want to check for placement. So we'll check for placement with our reserved stomach content. We'll check the acidity of the contents. When testing the pH of the stomach contents, you'll want to dip your test strip in your solution And then you'll have your test strip bottle, and you'll compare the color of your test strip to the color on your bottle. So you want your stomach contents to have a pH of less than 5. So when comparing the color of your test strip to the bottle, you should have either a yellow, red, or orangish color. So now that we're ready to administer the medication, before you administer, you want to flush your nasogastric tube. So we'll flush with 20 ml of water. Prior to administering the medication, you want to flush your NG tube to ensure patency. Flush. Once you flushed, ensure patency, now you'll administer your medication. After you've administered the medication, you will also flush the NG tube again to ensure that all medications have been